We are live on Facebook, and we are live on YouTube. Hello, and welcome to another edition of Truth with Teeth. Today is September 4th, 2019. My name is Reese, and as always, I am joined by Dr. Kumar T. Vadivel. He is a board-certified surgeon practicing as a periodontist specializing in periodontology, dental implants, and oral surgery in the Dallas-Fort Worth area. Dr. V holds a master's degree in dentistry from the University of Minnesota and is a fellow of the Royal College of Surgeons of England and Edinburgh. Dr. V?
Thank you so much, Reese, and thank you guys so much for joining us, and welcome to the current edition, today's edition of The Truth with Teeth. And we always appreciate you guys, following us on our website and Facebook and Quora and all areas, and submitting all these wonderful questions. And not only you're helping yourself, but also you're helping just the community, and thank you so much for taking the time to submit these questions, and we look forward to having a great show today. Thank you so much.
All right, looks like we got quite a few questions for us today, so let's just get started. All right, so our first question comes from Facebook, from Miss Otha here. Their question is, what is some good treatment for bad breath and bad gums?
So the question is, what is the treatment for bad breath and bad gums? So if you treat the bad gums, sometimes your bad breath may go away. So more than likely, if the bad breath is being caused by either bad gums or possibly by the bad teeth, like I said, more than likely, once you fix the dental condition, including your gum disease, the bad breath may go away, which is what we typically see in most of our patients that we have in the office. Do we see conditions other than the dental conditions or the gum conditions causing the bad breath? Possible, but we say in medicine, common things are common. When patients don't have other medical conditions, we always recommend they fix their bad gums and the bad teeth before they start just try to find other causes of the bad breath. So going back to how we can fix bad gums, to fix the bad gums, if you're noticing signs of bad gums, which are pain, swelling, loose teeth, tartar, a lot of plaque and black deposits, discoloration of the gum, bleeding, and swelling around the gum line. If you're noticing any of these signs, and the chances are you do have some gum disease and you are experiencing some gum disease, more than likely you may need either a regular cleaning if this is just the gingivitis, or if it is more than a gingivitis, which we call it as a periodontal disease or gum disease, more than likely you may need what we call it as a deep cleaning, or even further possible gum therapy after the deep cleaning. And also, if you have other bad teeth which are causing the bad breath, you will need to probably have those dental conditions treated also. So long story short, if you have not seen a dentist and if you're concerned that you have bad breath and bad gums, so go visit a dentist and talk to them about all possible options for your bad breath and the bad gums.
Absolutely, yep, we can help treat you. Just come on down and we'll see what we can do for you. Alrighty, next question comes from Instagram. Their question is, how do you recover bone loss and receding gums?
So the question is, how do you recover bone loss and receding gums? So the question is two parts. One is bone loss, and then the other one is the receding gums. And let me go back to the first thing, which is the receding gums. So receding gums, it normally called as either receding gums or gum recession or gingival recession. There are many ways we can fix that. We call it, generically we call it as a gum grafting. So the gum recession can be treated with gum grafting. There are several ways we do the gum grafting. In our office, for example, we either get the donor skin from the skin bank, or we can get your own gum tissue from the roof of the mouth or another place of choice. And those are the ways that we treat the gum recession. If you have bone loss, you have other ways to treat the bone loss, and we call it as a bone grafting. Instead of the gum now, it is bone, so we treat the bone or bone loss with the bone grafting. Depending on the type of condition that created the bone loss for you, so we have several ways to treat the bone loss. So you may need either some simple gum surgery just to do some either you can do some regular deep cleaning to correct the bone loss, because a lot of times we see just doing a deep cleaning may correct the bone loss. Sometimes you may need a gum surgery. It may not be correctable just with the deep cleaning. You may need some gum surgery, or you may need some bone grafting. In the bone grafting, we have several types of bone grafting that we do to correct the bone loss. Just like Reese says, come on down, and if you're in the Dallas-Fort Worth area, we will be able to help you. If you happen to be in another part of the town or another part of the world, and talk to your dentist or a periodontal specialist, and they should be able to help you.
Yeah, just give us a call. I'll answer the phone and I'll get you scheduled.
Thank you, Reese.
All right, let's go to a question from Cora now. This one comes from Rome. His question is, while overseas in Russia, I decided to remove old tooth root and have an implant tooth done all in one shot, then wait 3 months, and in America, add a crown. Is it a good idea?
So the question is, while overseas, this particular patient is from Russia. This patient decided to get the tooth removed and have an implant placed. And the way the implant happens is you need to allow for the dental implant to heal before a crown is placed, which usually takes about 3 months. So this person is asking whether he can have the implant done overseas and then come back to America to have the crown done. And he's asking whether it is a good idea or not. So in general, my recommendation is not to have an implant placed in one part of the world or one part of town. And I should say one part of the world, because within the US or within the same country, the practices may be the same. But if you have things done in one part of the world and then you go over to another part of the world to have the work completed, things may be completely different, and it may end up costing more than what it would normally cost to have everything done in one place. And then I'm not even worried about the cost, but sometimes you may not be able to find the parts and pieces needed to be able to complete the type of treatment that you need. Let me give you this example. Like, it's kind of like going to Europe, and then you're going to buy a car in Europe and you're going to come to America to drive the same car. It's not going to be the same car, because a lot of times if you're not going to buy the same brand of car that is available both in Europe and America, then you're going to end up in a situation that you can't even find parts and pieces in America. The same thing applies to the dental implants or any type of medical devices also. The medical device dental implant is a medical device. So if you're going to get things done in Russia and the same type of device may not be available, or it may not be FDA approved, the Food and Drug Administration approved in America, so we may not be, as surgeons in America, we have to be compliant with the FDA, so we may not be able to complete the type of implant that you got it done in Russia, which may not be approved, which is not FDA approved. When you come over to America, we can't even touch that implant. And if you have possibly an FDA approved implant, for example, the top 4 or 5 brands that we use in America are Nobel Biocare, Straumann, Zimmer, um, uh, Astra, Dentsply. So these are 3I. So these are top 4-5 brands that we use in America. So if you got one of those brands that was done overseas, possibly that we may be able to complete that treatment in America. But again, we are going to give you a disclaimer because we are not the one to place the implant to begin with. We may not be able to guarantee that implant is going to work. So overall, my recommendation is if you are going to start the process in one part of the world, have it completed if possible in that part of the world, and don't expect things can be completed when you are going to get done overseas. And being in Texas, I do have a lot of patients that go across the border to Mexico, Costa Rica, and we have a lot of patients that come from Asian countries, China, Pakistan, India. So they actually bring those implant parts and pieces with them because the surgeon told them whoever placed the implant overseas, they are telling them, okay, take it to the surgeon whoever is in America to get the treatment completed. But I repeat the same story when they come over to us, and then I tell them, hey, I'm sorry, I cannot touch this implant. Go back to whichever country placed the implant, you have to have the treatment completed. So long story short, it is a little bit difficult to control some of the factors. It is better to start the treatment in one place and finish the treatment. And particularly a lot of the times that the treatment is being done overseas for saving some money, but by doing what you're asking to do, it will actually end up costing more because you have to travel multiple times to this country to have the treatment completed. And I hope this answers your question.
Yeah, if you're looking to get some dental treatment done, absolutely stay in the same place. We can definitely take care of you all here in Texas at Implants and Gumcare. So stop on by.
Thank you, sir.
All right. Let's go back to Facebook for another question. This is number 3. What can I do to be sure my mouth is shut while sleeping? This one comes from Susan.
So the question is, what can I do to be sure my mouth is shut while sleeping? So this the question, it's kind of a little tricky and complicated than just what you may be thinking, because keeping your mouth open can be due to a variety of reasons. It may not be just a dental condition. It could be even caused by a medical condition. It could be due to snoring, because you snore a lot and you have problems with the airway. When you have a problem with the airway, that could cause causing what we call it as a sleep apnea, where you forget to breathe when you're sleeping. So it may not be as simple as you're thinking. If your question is related to prevent any kind of dental problems because you keep your mouth open, that could be a simple fix, and you can go visit your dentist to take care of that. But if your question is related to why you are snoring and you are thinking that you are snoring because you are keeping your mouth open, and it may be that you may have a medical condition or you have an underlying condition that is causing you to keep your mouth open and you're snoring, or you may have a sleep apnea, then you will need to consult with your medical team as well as your dental team. And if you want, you can get started with the dental team, and we are able to even sometimes diagnose even the sleep apnea depending on what we are able to see and what we are able to get for the medical history, that we are able to recommend some physician teams that we work with for treating the sleep apnea. And then at Implants and Gumcare, we do treat sleep apnea also with some of the dental appliances. So we are able to help patients even with the condition when they're able to when they're keeping their mouth wide. We're able to close their mouth to allow them to breathe better by using those appliances. So you're not going to be keeping your mouth open while you're sleeping. So long story short, again, come see us, and whether it is a dental condition or it is a medical condition, we are able to help you at Implants and Gumcare. Or if you're not happen to be in the Dallas-Fort Worth area, go talk to your dentist or someone who specializes in sleep apnea, and they should be able to help you.
Absolutely. All right, let's move on. Let's do another question from Cora. This one's number 14. Barbara would like to know, what are the pros and cons of the LANAP laser gum surgery?
So the question is, what are the pros and cons of the LANAP laser gum surgery? LANAP is spelled as LANAP. LANAP is a type of laser gum surgery that is done for treatment of gum disease, and particularly advanced gum disease. So there is not much cons to it, because everything that you can think of, like everything is a benefit by doing laser gum surgery. One of the only cons to that is not all gum diseases are treatable by LANAP gum surgery. So there are some limitations to what LANAP could offer. The benefits, we call it as a no cut, no sew, no pain procedure. So there is no cutting involved, and so there is very minimal recovery, and there is no sewing involved, and so you got a very good, less pain, and again less recovery, and there is no pain, just like the procedure claims. I shouldn't say no pain at all. There is very minimal very less pain compared to the traditional gum surgery. And also the other benefits of the LANAP laser gum surgery is what we call it as a minimally invasive or less invasive procedure compared to a traditional gum surgical procedure. Think of this. So you go to a hospital and the surgeon finds out you have like a small mass or like a lump in your abdomen, and the surgeon gives you the option whether, hey, do you want to have your belly open to have the mass removed, or you want us to do like what we call as a laparoscopic procedure, and you want to put a small keyhole, and then through that pinhole or a keyhole, then you remove the mass. Which one would you pick? Ideally and normally you would pick a procedure which is less invasive, right? So that's exactly what the LANAP or the laser gum surgery is all about. So if you want a minimally invasive option, a lot of times the traditional gum surgery can be treated using this less invasive or minimally invasive or the LANAP procedure, and we can definitely do that for you as periodontists or gum specialists. So if you are again in the Dallas-Fort Worth area, come see us and we are happy to help you, or find a periodontist who specializes in, or the dentist who specializes in the LANAP procedure, and they should be able to help you.
Would LASIK be a good comparison to LANAP?
Oh,
LASIK
yeah,
compared to just
absolutely.
regular eye surgery?
Yeah, great comparison. Yeah, so if you guys know what a LASIK eye procedure is, which is a kind of a laser eye procedure versus a traditional eye surgical procedure. Nobody does the traditional eye surgery anymore. Like when I say nobody, meaning very small fraction of the people getting the traditional eye surgery done. A lot of times it's about 90 to 95%. I don't know the exact numbers. Don't quote me on this, but my understanding is about 90 to 95% of the time, and the eye procedures are done by the LASIK. Mm-hmm. Yeah, great example. Thank you. Reese.
All right, let's move on to another laser question. This one comes from Sierra. It's also on Quora. Is laser therapy necessary after root planing and scaling? Can I choose not to do laser therapy for deep cleaning?
So the question is laser therapy needed after root planing and scaling? Can I choose not to do laser therapy for deep cleaning? So the answer is yes or no, depending on your gum condition, depending on the practitioner that you are going to be seeing, the dentist or the periodontist you are going to be seeing. As you might know, the different doctors have different ways of treating the same condition. So you may be seeing a dentist or a periodontist who believes in doing the laser followed by the scaling and root planing, or root planing and scaling. And some dentists or some periodontists not always use the laser followed by the scaling and root planing, and the healing may be just fine. Again, is it mandatory that you have to use a laser? Absolutely not. And we have patients in our office, and we do traditional gum therapy, the traditional scaling and root planing in our office, and we do not use the laser at all. Every time that we do the scaling and root planing. Do we use sometimes the laser therapy along with the scaling and root planing? Yes, we do. So it depends on the condition. Again, going back to your question, it is not mandatory. However, depending on the type of gum condition that you may have, depending on the area that you live in, depending on the practitioner that you're going to, they may choose to do laser, and there is nothing wrong with it. And if you're able to go through the procedure with no problems, or if you're able to afford the extra cost that may be involved in doing the laser gum procedure along with the scaling and root planing, is it beneficial to do that? Absolutely, yes.
All right. Let's go back to Facebook for another question. This one comes from Jeanette. Her question is, my teeth are failing. What is the best process for implants? Two different dentists have told me two different processes.
So the question is, my teeth are failing. What is the best process for implants? Two different dentists told me two different processes, which is the best option. So this is one of the stories I share with my patients all the time when they come into my office. And patients are coming into me for first time consults. Sometimes they come in for second time consults, or a third consult, or a fourth opinion, whatever the case may be. I tell them, particularly for those patients who are coming in for a second opinion, or a third or a fourth opinion, I tell them, hey, listen, if when I have you in this room, if I'm going to call 3 of my colleagues to this room, 3 of them may have a different way to approach, but the end result, everybody's goal is the same, depending on what your end goal is, right? So whatever your goal may be, the dentist's goal is going to be the same. How we are going to get to that? The route may be different, the destination is going to be the same. This is one of the common things that happens in my practice. Patients come ask me all the time. So for example, the reason that you are asking is, one dentist may have told you, you need to remove all the teeth, you have to clean out all the infection, you may have to wait for 3 or 4 months before you get the implant, you may have to wait another 3 or 4 months before you get the final teeth. Another dentist might have told you, you can remove all the teeth, you can place implants at the same time, and you just only wait for 3 months and you can finish the case in about 3 months. There is nothing wrong with doing one way or the other. Each practitioner, or depending on the gum condition that you may have, one person may choose one type of practice over the other. There is nothing wrong with it. Again, like I said, the route that you're taking may be different, but the end result or the destination is going to be the same. So depending on the condition that you have, talk to the dentist that you felt comfortable with and ask them why they are recommending what they are recommending, and they should be able to give you their best opinion and their best recommendation. And if you want a second opinion, if you happen to be in the Dallas-Fort Worth area, come see us and we'll be happy to help you, just like we have helped many other patients with the second, third, and the fourth opinions. We would love to help you.
Yeah, whatever you're looking to have done, we'll get you a treatment plan that'll get you there.
Thank you.
All right. Let's go back to Cora for another question. Is it okay that my temporary crown is laying outside my gum line? The inside part facing my tongue clearly has the gum flap inside the crown. And that one was from Ian.
So the question is it okay that my temporary crown is laying outside my gum line? The inside part facing my tongue clearly has the gum flap inside the crown. So in other words, patients is possibly, like from what you're describing, it feels like there may be that maybe a small ledge, or there may be a discrepancy that you're feeling on the outside of the crown versus the inside of the crown. Again, without looking at your tooth, I can't really tell why there is a discrepancy. Again, it could be due to the type of condition that you may have. You may be just fine the way crown is. And so my recommendation is you talk to the dentist, whoever did the temporary crown, and particularly if you keeping the temporary crown longer than what is recommended. Usually the ideal recommendation is not to keep the temporary crown more than a 2 or 3 week period, not like ideally, like you don't want to leave more than 3 weeks. Sometimes it could be up to a couple of months or maybe 3 months. You don't want to go anything longer than that. So have a discussion with your dentist and they should be able to help you. And if you're not finding the luck to talk to your current dentist, then if you're looking for a second opinion, find a dentist in your area and ask them to check out whether whatever the other dentist did, whether is the right way they did it or not, and someone should be able to help you. Again, if you happen to be at the Dallas-Fort Worth area, come see us and we'll be happy to help you.
All right, let's go back to Instagram for another question. This one comes from Ray. Their question is, they are a cancer patient in remission from sinus brain tumor. They lost my teeth from treatment, and they have dentures, but they're very concerned about loss of their jawbone. Can you help, please?
So the question is, I'm a cancer patient in remission from sinus and brain tumor, lost my teeth from treatment, have dentures, but very concerned about a loss of my jawbone. Can you help, please? So a lot of times these cancer patients have either a sinus tumor or like any type of a jaw tumor, and this is going to involve removing part of your jawbone, part of your sinus to treat the cancer. This is like kind of a common occurrence, because you want to survive. It is kind of survival versus the good looks. So you're going to end up removing part of the jawbone or the sinus or whatever the case may be, so to make you free of cancer. However, this comes with the jawbone being part of the jawbone being removed. Now you have lost teeth, so you want to be able to reconstruct the teeth, and it is not easy for me to say, depending on the condition that you have, whether I'm able to help. My best recommendation is, obviously, if you had a cancer removed, you probably worked with either your oncologist or an ENT surgeon or possibly an oral maxillofacial surgeon. A lot of these cases are usually dealt very well in a dental school setting, because you also, as part of the team, you also have what we call it as a maxillofacial prosthodontist, prosthodontists. Prosthodontists are specialized dentists. They are able to help you in reconstructing part of the jawbone that is missing with a prosthesis. So for example, we see a lot of patients when we are in dental school being treated by the prosthodontist. They're able to make a maxillary or a mandibular prosthesis to be able to reconstruct a part of the lost sinus bone, part of the jawbone on the top or on the bottom. So my recommendation is, based on where you live, look for a prosthodontist or talk to an oral maxillofacial surgeon, or again, if you happen to be in the Dallas-Fort Worth area, come see us and one of us should be able to help you. But the most common practice is these type of patients are best dealt with in a dental school setting.
All right, let's move on to a Facebook question. This one comes from Daisha. Her question is, I have decaying teeth. What can I do about the odor until I can have it removed?
So the question is, I have decaying teeth. What can I do about the odor until I can have them removed? So if you have decayed teeth and if you have bad odor, and the bad odor not necessarily comes from the decayed teeth, but it could be coming from the gum disease you might have. So if you have the decayed teeth fixed, or even if you buy some over-the-counter temporary cement and then you put it on there, it still may not stop the bad odor, because now you have gum disease in addition to the decayed tooth. It may not be the fix that you want. So my recommendation is based on what you're asking me, is you need to go see a dentist and you need to find out whether the bad odor is coming from a broken tooth or a loose tooth or gum disease, and depending on the condition that you have, they may be able to recommend a treatment for you. If you're really looking for like a short-term fix, like for a few days, can you use possibly like a breath freshener or like mouthwashes and things like that to get rid of the bad odor? Possibly, but sometimes it may make things worse, and so that is why I'm kind of hesitant to recommend anything. However, you can try these measures, and if they are not causing any extra discomfort, you can buy maybe a few days or maybe a couple of weeks before you go see the dentist.
All right. Let's go back to Cora for another question. This one comes from Kata. The question is, "Hi doctor, my father chews tobacco. For a few days he is getting a cough and he is feeling spicy while eating and getting watery eyes from due to the spice. Could this be a starting stage of cancer? Can we cure it?"
So the question is, my father chews tobacco. From few days he is getting cough and he is feeling spicy while eating and getting water from eyes due to spice. Could this be starting stage of cancer? Can we cure it? So the general rule of thumb is, if you chew tobacco, depending on how long you've been chewing tobacco or how long you've been using some type of smokeless tobacco, it is possible that you may get cancer. Not everybody is going to get cancer. A lot of times, it could be a pre-cancer, or it may not be even a pre-cancer, but you're able to see some signs of cancer, for example, like a white patch, or sometimes like your dad is experiencing it could be some cough, or he's feeling spicy because this is causing the tobacco is peeling off some of the gum tissue or some of the cheek tissue. Now when he's eating the same type of food that he used to eat, but now he is feeling it spicy because the tobacco is causing some kind of damage to the cheek tissue or the gum tissue. So my recommendation is, immediately as soon as you find out, now that you have found out that he's feeling some kind of uneasy symptoms, or he's feeling something in his mouth, particularly he's chewing tobacco, you definitely need to see a dentist to see whether he has either pre-cancer, or he has cancer, or he has no cancer. A lot of times when you go to a dentist, they are not able to do anything, because more than likely, from what you're describing, your father may need what we call it as a biopsy, or meaning a sampling of the tobacco affected tissue. So a lot of times you may have to find a specialist like me, a periodontist, or you may need to find a specialist like an oral maxillofacial surgeon, who are able to perform a biopsy. Not only perform a biopsy, depending on the condition your father may have, recommend treatment as needed. So my recommendation is seek attention from a dental specialist, either a periodontist or an oral maxillofacial surgeon, and they should be able to help your father. And I hope this answers your question.
First off, I would stop chewing that tobacco, right, doctor?
Absolutely, yes. Stop chewing the tobacco immediately. Yes, sir.
All right. Let's go back to Instagram for another question. This one comes from Tasha. She would like to know, what's the best insurance for dental care?
So this is, so the question is, what is the best insurance for dental care? This is one of the most common questions asked about our patients all the time. So the real answer is, like, there is no such thing as best dental insurance for best dental care. It really depends on a variety of factors. For example, most of the common insurances they see, like for example, like MetLife Dental or a Delta Dental, for example. You may have a Delta Dental insurance. You may be working for example, IBM, and your husband may be working for Google. The coverage from dental may not be the same now because you're working for two different companies. Because depending on what your employer chose to give the employees, although you may have the same Delta Dental, the two Delta Dentals are not the same. They may have different type of coverages. And you may have a Delta Dental and somebody else may have a private insurance. Now the private insurance may not be the same as the Delta Dental that you have with the group. And sometimes we have the same Delta Dental or MetLife Dental with a regular private company versus somebody working for the federal government. It is not exactly the same. So in other words, all insurances are not the same. All insurances are not going to have the same type of coverage that you would expect. And for dental insurance, a lot of times it may or may not matter because you're always going to have a ceiling. For example, all dental insurances have a cap. They're going to pay a possibly a maximum of $1,000 or $1,500 or a $2,000 max. And very rarely we see anything other than the $2,000. For example, like some federal plans that we have, they have coverage, unlimited coverage. But more than likely, most of the insurances are going to have a ceiling of about $1,000 or a $2,000 or $2,500. So it may not matter. But what might matter is, for example, this is one of the common things that we see. You have a $2,500 coverage with your insurance, but they don't cover a dental implant. You may have $2,500, but if you broke a tooth and if you needed a dental implant, now they are not going to cover that. So this is a question that you may need to have either if you are going to take an insurance with your company, that you will need to have a conversation with your HR, or if you are going to take a private insurance, then this is a conversation that you may need to have with your insurance agent. A lot of times, the first example that I gave you, although you may want to talk to your HR and want to get the best coverage, for example, you want to have the dental implant coverage. However, if your employer chose to not have dental implant coverage for the whole company because that is the way they set their premium, and you cannot have a dental implant coverage. So period. So the answer to your question is the dental insurance can be done a variety of ways. The best way to find out what kind of coverage that you have is to go see a dentist and then ask them what is your dental condition, whether that is going to be covered, and possibly if you're, now that we are being close to the end of the year, and if you have specific dental conditions, when the plan is going to be open, then depending on the plan that you're going to choose for next year, you can talk to your employer and then see whether you can choose a plan that is going to cover some of the dental conditions you have. So talk to your dentist and talk to your company that you work for, or talk to the insurance agent, and as a team they should be able to help you.
Yeah, and as always, it's going to take a little bit of research just to figure out exactly what you want. But if you want to have insurance that works with us, we accept all PPO insurances here.
Thank you, sir.
All right. So let's see. Let's go back to Facebook for another question. Let's go to number 10 here. This one comes from Chelsea. Why can't any dentist tell me the price of anything ever? Why do I have to miss work, spend time and money, go to the dentist just to find out the price of something? Repeat till I find affordable?
So the question is, why can't any dentist tell me the price of anything ever? Why do I have to miss work, spend time and money, go to the dentist just to find out the price of something? repeat till I find affordable. I completely understand your question, and this is one of the most common conditions, most common questions that we be asked a lot of times and several times during the week or several times during the month. So what we do in our office is, for example, like we do a lot of extractions in our office, removing teeth or dental implant or doing some gum grafting. These are the most common procedures that we do. So if someone calls me, then I tell them, hey, for example, a dental extraction can range from $250 to up to $400 or $500. I cannot give you a quote on the phone because I have not seen your mouth. I have not seen the x-rays. A lot of times patients are asking, hey, can I send the x-ray and can you look at the x-ray and give me a quote? No, I can't, because I got to look in the mouth. And patients get really smart and they're going to say, oh, let me take a picture of with my iPhone and send you a picture and then send you an x-ray. Can you look at it? Well, obviously we cannot diagnose based on the picture and an x-ray. So let me ask you this question. And let's say you own a car garage company and you fix cars, and if you're a mechanic and if you're asking me this question, and if you're a mechanic, can I call you and then ask you, hey, my car is making some noise under the hood. Can you tell me how much would it cost to fix my car? What are you going to ask me? Well, hey, I don't even know why your car is making the noise under the hood. It could be a simple screw that is loose, or it could be like your engine is kind of blowing out and it's just about to blow out, and that's why it is making noise. So it could be a range. Fixing a screw may cost like as simple as maybe $5 or $10, and fixing the motor, it could cost anywhere between $10,000 to $15,000, and it may not be even worth repairing your car at that time. So the same answer. So you don't call your car garage and ask them, hey, my car is not making some noise under the hood. Can you tell me how much is it going to cost? And just like that, they are not going to be able to give you a quote over the phone. The same thing applies to the dentistry also. So just because you were told by one dentist, well, you need a crown, or you need a root canal, or you need an implant, we cannot just diagnose over the phone and we can give you a quote over the phone. We want to be able to see you, and if you are concerned about like the cost, you may be able to find someone who are able to do a free consultation. If you are concerned about the time that you have to spend out of your work, and I'm sorry, you may have to talk to your employer and then see, or maybe if you're not working on the weekends, there are several dental offices that are open for the weekends, and they should be able to give you a quote when you go see them. And I hope this answers your question.
All right. Let's go to our next question. This one's another Instagram question from Carlos. Their question is, I need a couple implants. The first visit to evaluate, it's free?
So the question is, I need a couple of implants. The first visit to evaluate, is it free? To answer your question, yes, it is free with our office. Is every single office going to offer the consultation for free? Possibly not. Every single office, they have their own policies and procedures, how much they charge for the consultation. But it's not difficult for you to find a dental office which is willing to offer a free consultation for your dental implants. So check your phone book or check on the internet which office is offering a free consultation. Type on the internet, Google it, free consultation for dental implants, and I'm sure you should be able to find a dental implant center or a dentist offering, or an oral surgeon or a periodontal like me offering a free consultation for dental implants, and they should be able to give you a price for your dental implant that you need. And if you happen to be in the Dallas-Fort Worth area, come see us. We offer the free consultation. Not only the free consultation, we also offer you a free CAT scan, and there is no obligation to find out what you exactly need, and we'll be happy to help you.
Absolutely. All right, let's go back to another Facebook question. This one comes from Carl. Carl would like to know, I want implants, but I am an HIV patient and not sure if I can have or afford implants. Can I?
So the question is, I want implants, but I'm a HIV patient and not sure if I can have or afford implants. So to answer your question, HIV is not a contraindication for the dental implants. So depending on the condition that you may have, several times during the week I see a lot of HIV patients in my office, and HIV is not as serious of a disease that it used to be, to my understanding, because the times that I see the HIV patients in my office, and a lot of times when I'm asking them the question, hey, how long you been an HIV patient, a lot of times patients are saying 5, 10, 15, 20 years, and they are leading just a normal life. Their health is completely normal, and their viral load is completely undetectable. They are taking antiviral medications. There are no side effects, and their life is as good as normal it could be. So in those patients, doing a dental implant is not a contraindication at all. You just treat them like a regular patient, and your risk is not any higher than doing an implant even if you're HIV free. So to answer your question, you can definitely have dental implants. So the second part of your question is, can you afford for dental implants? Yes, absolutely. In our office, we do have a variety of payment options we offer for patients with dental implants, needing dental implants. The dental implants, I tell my patients, it could cost like as low as about $99 a month, on a monthly payment plan. So depending on the area that you are in, if you happen to be in the Dallas-Fort Worth area, come see us and we can make the dental implant affordable for you. Or depending on the area that you live in, find a dentist and talk to them and whether they do dental implants and what kind of payment plan options that they have, and whether they can make it affordable for you in a way that is going to fit your lifestyle and budget. And I'm sure you will be able to find someone. And again, happen to be in the Dallas-Fort Worth area, come see us. We can definitely help you.
Yeah, if you need help and are looking for something affordable, we're definitely there for you. All right, let's go for another Cora question. This one comes from Sunil. The question is, can weight loss cure sleep apnea?
So the question is, can the weight loss cure sleep apnea? So the simple answer is, it is possible. One of the reasons why you have sleep apnea, one of the variety of reasons why you can have the sleep apnea is because of the overweight. The sleep apnea could happen for a variety of reasons. It could be some kind of an airway issue, or it could be the excessive weight, or it could be a variety of medical conditions, for example, high blood pressure, diabetes, and other variety of medical conditions. However, if you don't have anything else, and if it is just the overweight, and can that cure your sleep apnea? Possible. We have seen a lot of times that patients were overweight. Now they reduce their weight significantly. Now they are completely cured from having sleep apnea. That is possible. And my recommendation is you talk to your doctor, your physician, and see whether you are a candidate for curing sleep apnea by reducing the weight. And I'm sure he will be able to give you a recommendation based on the condition. And a lot of times when I tell my patient, it is always worth giving it a shot. Like, let's say you are overweight by 50 pounds, and if you have a way to reduce your weight by 50 pounds by non-invasive means, for example, good dieting, good exercising, and leading a good lifestyle and all of that, it is absolutely worth a shot. If you happen to do it that way, my recommendation is you go see a sleep specialist, or a sleep doctor, or even your primary care specialist, and talk to them. Tell them, hey, this is what you're thinking. this is what you plan on doing, and is this a good idea? And I'm sure they should be able to recommend something for you. And knowing what I know now, if I'm overweight and this is something would I try by losing some weight by non-invasive means, absolutely, give it a shot, and you're not going to lose anything by giving it a shot.
What are some good dental options for curing sleep apnea?
Great question. So what are some dental options for curing sleep apnea? So the question, the answer will be, we do in our dental office, if we find out that you have sleep apnea, and if it can be helped by using a dental appliance, we make a dental appliance or like a sleep appliance. And sometimes it could be done just as a standalone sleep appliance, just you wear in your mouth, do it every night, or we may have to work with a sleep specialist. If you have a significant sleep apnea, then you may need other medical treatment or other medical devices along with the dental devices also.
Oh, okay.
Great question, by the way.
Yeah, all right. Let's do another one from Cora. This one comes from Lily. She would like to know, what should I do if I poked my wisdom tooth socket and it started bleeding? I am on day 6 after wisdom teeth removal. I used a toothpick and only a bit of blood was on it. I began rinsing with the syringe after, and it was oozing blood.
So the question is, what should I do if I poke my wisdom tooth socket and it started bleeding? I'm on day 6 after wisdom tooth removal. I used a toothpick and only a bit of blood was on it. I began rinsing with the syringe after, and it was oozing blood. A lot of times it is not uncommon for you to see some kind of a oozing of blood, even days after the procedure, or even sometimes we have patients on blood thinners and they see blood oozing from the socket even weeks after. It's just not uncommon. As long as it is not a profuse bleeding, what that means is, the bleeding you cannot control, or it keeps oozing and you're changing the gauze piece over and over and you're not able to control, that may be a cause for concern. A lot of times, just like you mentioned, if it is just a simple oozing of blood, a lot of times you're able to put some pressure. For example, if you had a cut in your finger, you're going to put some pressure right on the top of the cut to hold it, and the bleeding will stop, right? So the same thing, if you have bleeding from the back of your mouth where you had the wisdom teeth removed, and you take a bit of gauze that was given by your practitioner, or if you don't have one, you can buy them very easily from the drugstore. You take either a 2x2, a 2 inches by 2 inches, or a 4x4, 4 inches by 4 inches gauze piece. Fold them in half again. I tell my patients to make it just like a golf ball, and you put it in the back of the mouth and you just bite down on it for about 20 to 30 minutes, and the bleeding should stop. And if you're concerned, if you're still bleeding before you go to bed, put the gauze pieces in the mouth. If it is a 4x4, you can even leave them in the back of your mouth. Go to bed in a recliner and make sure that you're not going to choke on them, and you can go to bed in a recliner. And if you're concerned about the choking, if you don't have the 4x4 gauze pieces, you can even take 2 tea bags with the strings on them. You can put them in the back and you can just bite down, and the tea bags will help you put some pressure just like the gauze pieces. And also the tea bags, what we call as a tannic acid in them, that also helps with the blood clotting, and that should help you with stopping the bleeding. Long story short, again, if you have a little bit of oozing from the wisdom tooth socket, not to be concerned. You don't have to be concerned. Just put some pressure with either with some gauze pieces or using the tea bags, and that should take care of itself. And if you happen to have continuous bleeding, I recommend you seek immediate care with your dentist or the surgeon who removed the tooth.
All right, looks like we have time for maybe a couple more questions. So let's go to number 12 here from Facebook. This one comes from Mr. John. He would like to know, how much is all-on-4 implants for the top?
So the question is, how much is all-on-4 implants for top? So the answer is, it depends, and sometimes we just cannot give you a quote, just without knowing you, without seeing you. I can give you a general answer. It could range anywhere between $15,000 up to $30,000, or maybe it can go up to even $50,000 or even $80,000, depending on what your expectation is. So the range is kind of huge. Like I said, it can start at $15,000, $15,000, and it can go up to $80,000, which is $80,000. So it is a huge range, depending on what type of treatment that you need, depending on what type of tooth that you need, depending on what is your expectation. Variety of factors dictate the price for an all-on-4 treatment. The best answer that I could give you is whoever the surgeon is, whoever the dentist is you're working with, ask them if they have given you a price range, what does it entail? Why is the cost for one treatment is more versus the other? Or why is the treatment for one treatment is less over the other? Ask them all sort of questions, that way you can make an informed decision on why is that costing what it is costing. And if you happen to be in the Dallas-Fort Worth area, come see us at Implants and Gumcare. We'll be happy to help you. We do all-on-4 back-to-back every single day, and we can definitely help you.
All right, let's see. Let's try and get one more Facebook question. This one comes from Pablo. His question is, he needs 3 teeth fixed in the front. What can I do?
So the question is, I need 3 teeth fixed in the front. What do I do? So depending on the condition, without seeing you, I cannot tell you what do you need to do to fix the 3 teeth. And if the teeth are just slightly broken, you may be able to fix it by going to the dentist and maybe do some bonding and then be done with it. If they are slightly more broken, and you may be able to still fix that at your dentist, and you may be able to get what we call it as a crown to be able to fix those. And if they're completely broken at the gum line and to the degree that they cannot be salvaged with any type of restorative procedures, just such as bonding or a crown, then you may need to have those teeth replaced or removed first to prevent any type of infection from spreading. So once you have those teeth fixed, teeth removed, then you got few options now. Either you can do nothing, which I don't recommend. You don't want to be going around with no teeth in the front, particularly the front teeth. And you can do either a bridge, what we call it as a dental bridge. You can solder down the 2 teeth on either side and get a long bridge. Particularly if you're going to have 3 missing teeth, I don't recommend doing a long span bridge, which is not a good idea at all. You can temporarily or you can permanently have a partial denture. Again, it's not a good idea to have a partial denture depending on your age, and it may not be the best idea. And the best possible treatment that you can have will be the dental implants, and possibly the 3 teeth can be replaced with the 2 dental implants and a dental bridge, and that would be the best possible fix. So to answer to your question, you can either have some restorative treatment or you can have the teeth removed and replaced with as simple as a partial denture or as best as the dental implants.
Yep, and whatever way you're looking to fix those teeth, we got you covered.
Absolutely. Come on down and see us and we can definitely help you.
All right, so that looks like it does it for us tonight.
Well, thank you so much, guys, and thank you for joining us for another episode of The Truth with Teeth. And thank you, Reese, for just hosting the show tonight. And Truth with Teeth, this is the hub for getting any kind of question that you need, anything to do with the teeth. And we got followers from all over the world, and they're posting us questions through our website, implantsgumcare.com, or search Kumar Vadivel, last name V as in Victor, A-D-I, V as in Victor, E-L, first name Kumar, K-U-M-A-R, Google Kumar Vadivel DDS or Implants and Gumcare. You will end up hitting our page somehow or the other. We got many followers with Facebook, Instagram, Quora, and we would love to help you. So just feel free to just keep bombarding us with all the questions that we need, and we will answer them for you. Until next time, see you at Truth with Teeth. This is Kumar Vadivel. We look forward to meeting with you next time. Thank you so much.
See you in October.